And welcome to another edition of On a Mission. I'm Brian Sexton, in for Jack Sears, as we investigate great nonprofits and the work that they're doing in their communities. And today, really pleased to introduce to you Deneen Richmond from Luminis Health Doctors Community Medical Center, just outside Washington, D.C. Deneen, how are you?
I'm great this morning, Brian. How are you?
I'm doing great. Even better now that we get the chance to find out the things that you are working on up outside of our nation's capital. But let's start with your first idea, and that is, what nonprofit do you have the biggest heart for, and how do you support it?
Absolutely. So the organization that I have the biggest heart for, not surprisingly, is my organization. We are a not-for-profit organization as a community hospital here in Prince George's County. And I have a dedicated foundation, which is also a not-for-profit organization, to help us advance our mission. So why I have such a heart for our organization is because of our commitment to really enhancing the health of the patients and community we serve. And specifically, we are uber focused on improving access and reducing disparities. I'll just highlight one of those areas that's around women's health.
Okay.
So as we celebrate our 50th anniversary, we know there's lots of work to do to address disparities, particularly around obstetrical care. Not only do 8 out of 10 moms in Prince George's County leave the county to deliver their babies, we also have a lot of work we need to do around decreasing disparities in maternal outcomes, particularly with our Black moms with maternal mortalities. So we are bringing obstetrical services to our campus, and we'll have the capability to deliver up to 2,000 babies a year starting in the summer of 2028. So lots of work and planning is underway right now, and we're connecting with the community and doing everything we can to make sure that women are at their healthiest before they get pregnant, that we keep them healthy during their pregnancy, and that we have a place for them to safely deliver their baby close to home.
Deneen, I have to imagine that the response in the community has been overwhelming to that number. 2,000 babies delivered right there on your campus in their county. How has the response been? What have you heard from your prospective patients and from people like you who are very concerned about this all-important issue?
Yeah, so the response has been great. You know, I have lived in this county. My youngest is now 26 years old, and I was one of those moms. I did all of my prenatal care in the county, but my physician at that time, my OB physician, didn't deliver here in Prince George's County. So I shared the community's excitement, and we are absolutely hearing positive input from the community and support for this. We have already opened up an OB/GYN office very close, just a few miles from the campus. And that particular physician is doing her GYN surgeries on the campus, at least being able to see those women here close to home, and doing her deliveries at our sister hospital until we have our obstetrical unit ready to roll. So lots of support. Most women would say, you don't want to have to drive far when you're in labor. So lots of support and just knowing that there's going to be a place where they can get quality, safe care close to home.
You obviously have a great story to tell, and as we get towards 2028, that story is going to get even better. What lessons have you learned over the course of your career and your time there in the county that you can share with other folks about success in an endeavor like this?
So I have a motto that I like to live by and direct me, which is be the change that you wish to see in the world.
Yes.
And perhaps I can't influence the entire world right now, but I can influence what's happening in this community and in the service areas around us, where people need and deserve to get quality health care. So when I think about that as a hospital president, my role is to take action, right? We could talk about these things all day long, but we need to take specific and concrete and focused actions to address them, not just talk about them. So we're talking about a life and death matter, eliminating maternal and infant mortality. It also happens to be a bold goal, a bold 2030 goal, strategic goal for my health system. And we've done this in other areas too. So there was a huge need with behavioral health. So 2.5 years ago, we opened a behavioral health pavilion. Now we're addressing maternal health. So we will continue to be here in the community. As I shared, we are celebrating 50 years and just continue to be the change and do the things that are going to make a difference for the community.
You may have just answered this question, Deneen, but when people look at your career and the team that you've built and the things you've achieved, what do you want them to remember about you?
So I want to be remembered for someone who impacted people's lives in a meaningful way and made things better for them. Because that, once you make things better, you're talking about generational improvement. And as I mentioned, it's an area that Prince George's County is where I call home. So I want to really and be that vehicle to live and breathe my organization's mission at Luminis Health of enhancing the health of the people and communities we serve. That's what I really want to be remembered for, and I work hard at it every single day.
Well, listen, I'm sure you're not just going to be remembered for it, but that people are talking about the changes that you're making. Such dramatic impact in such a key area of overall health. When the health of the mother and the baby are at the forefront, then the health of the child who becomes an adult is so much greater. What an amazing story to tell, and it's just the kind of story that we love to tell here on a Mission. Thanks so much for joining us today.
Thank you so much, Brian. I really appreciate you helping to get our story out there.
This is an important story that needs to get told, and we'll put your information, your website, on our show notes so that people can find that and help you in your mission. Again, great to hear your story, and continued success and prayers for your endeavors up there outside the nation's capital, Deneen.
Thank you so much.
And we'll see you next time right here on a Mission.